My name's Rainer Mako, and today we're going to use a Suresult D3 Ultra handheld ultrasound to evaluate a wrist for wrist pain. In particular, we're going to be checking for DeQuervain's tenosynovitis or DeQuervain's disease, because we have a new mother here who has wrist pain sort of in this region, which is sometimes called mommy wrist, because it's associated with having a new baby. But I have my suspicions that it might not be DeQuervain's disease, because when I do Finkelstein's test, it doesn't exacerbate her pain. Now, these structures are very shallow, so the higher frequency unit you have, the higher resolution images you will get. So I do recommend something like 15 megahertz, 18 megahertz would give you better pictures, but I'll show you that even with 10 megahertz, we should be able to diagnose this issue. Now, DeQuervain's disease, or tenosynovitis, is a stenosing tenosynovitis of the first extensor compartment, containing the abductor pollicis longus and the extensor pollicis brevis. What we expect to see is a markedly thickened retinaculum over that compartment, and is often associated with hyperemia, which is increased signal on Doppler, and tendinosis of the tendons. In terms of patient positioning, I like to have a table like this where the patient can just plop down their hand and I can move it around and place the transducer on. It's nice and easy and relaxed for us. So let's get started. Okay, we'll need some gel. The patient can place their wrist on. Now, if you're not sure if it looks normal or not, remember you can always use split screen to compare the symptomatic side with the asymptomatic side. So you always have that option. So we're just going to start with images here. I'm actually going to start with Lister's tubercle because that's a nice, easy to find landmark. Right, because it's a nice, big, bony landmark. Now, I can put compound imaging on or off. Off will give me better frame rate. On will give me better pictures. And of course, I can look around and move around with it off for that better frame rate. And then I can turn it on when I want to take a picture. So let's turn it off for now so I get a slightly improved frame rate. And you can see this bony ridge here. That's Lister's tubercle. So as I move, I'll now be in the second compartment with extensor carpi radialis, brevis, and longus. And then if I go even further, we'll end up in the first compartment. So there's the first compartment. And so here we have the first compartment here. And that does not look abnormal to me. There's no abnormal thickening of that. So that looks normal to me. Now, don't just take one picture. Make sure to screen through structures and to look at structures in two planes. So come back. Don't go anywhere. Where was I? So here I am. So I'm going to screen through. And I can rotate the transducer, look in long axis. And yeah, I still don't see any stenosing tenosynovitis. Okay. Now, can you show me where your pain is again? So it's actually a little bit more posterior. Okay. And do you get relief if I hold pressure here? Does the pain start going down? Try that wrist movement and see if it still hurts. Does it still hurt?
Just a little bit,
but the pain is less?
Yeah.
Okay. So the pain ended up being a muscle knot. And not a stenosing tenosynovitis. Anyway, I hope you found this useful. Cheers!